Okay. Today our guest is Dr. Kadan. Welcome.
Thank you.
And today we have some questions about the trend flowing with older adults getting braces. So what are some of the signs that older adults need braces?
Well, a bite that does not look, first of all, self-consciousness about the smile. Crooked teeth, sideways bite, where if they're when they're biting, they're not comfortable. The teeth don't touch the way they're supposed to. That includes overbites, where the top teeth are jetting out. Open bite, where you can bite down and still stick your tongue through. Sideways bite is where you have your bottom teeth jetting on the sides, and the general crowding of the teeth, whether it's for the top or for the lowers. As long as the gums and teeth are healthy, we can move teeth. Of course, anybody who's interested in orthodontic treatment should have a general dentist who maintains their teeth every 6 months or every 3 months for cleanings and such.
Okay, so what are some of the benefits for adults getting braces over 30?
Well, we see a lot of patients who, a few categories. We see a lot of patients who never got the opportunity to straighten their teeth as kids, whether it was for financial or lack of available orthodontic professionals in that area. So they go to college, they have a job, they have insurance, and they start looking at their smiles, and they say, I always wanted to have that nice smile. So that's one kind of 30-year-old patient. Another kind is a patient who has had braces, however, they did not wear their retainers. What happens is if retainers are not worn, then the teeth will slowly move back. So that's a very common situation. Third is they have had braces, they thought they looked okay, but now they've noticed teeth move, whether it's because of gum disease or a tooth got removed and teeth started moving into those spaces. So these are situations where a 30-year-old and above could be looking, or even 20-year-old and above could be looking for orthodontic treatment again.
Okay, what are some of the risks of
orthodontic treatment?
Yes.
The risks are typically minimal, but most common is hygiene. If they get braces will trap foods, and if the foods are not brushed away from the teeth and the gums, you can get cavities. You can get gingivitis, which is typically reversible, but on a long-term basis, we're talking a year or two of that. With an adult, you can get cavities, you can get periodontal disease, so you really have to be very good with the brushing. The other complication that sometimes we see, but rarely, is root blunting and shortening of the roots. That's most of the time is genetic, meaning we don't know that a person would get that kind of blunting of the roots before we start the orthodontic treatment. Sometimes extended periods of orthodontic treatment, 4 or 5 years, can elicit that kind of reaction. Sometimes we have people that start out with TMJ, which is the jaw joint that's here. It gets sometimes worse. Orthodontic treatment does not fix TMJ problems. But generally speaking, complications with orthodontics are very minimal.
Okay. So are the braces for younger adults more costly than the ones for the older adults?
We do not, personally, our practice, we don't charge differently based on age. Orthodontics for adults tends to be a little bit more involved because sometimes the teeth don't move as quickly in the bone. But a typical course of treatment is anywhere between 1.5 to 2 years, even for adults.
Oh, okay.
So, but as far as to answer your question, we don't charge differently for adults versus teens or children.
Okay. Now, does the cost depend on the brand of braces that they get?
It's on the type. So the basic kind of braces is the metal, which is here, and where you have metal brackets and a metal wire that goes through them. So if you were to get those braces, if you walked into a room, I would notice sitting across that you have braces. So this is the basic type of orthodontic appliance, the braces that most children wear, and teens. The second kind of braces that would be a little bit more expensive is the clear braces. So if you walked into a room, I would not see that you have braces, but if I'm sitting across from you having lunch, I would see the wire. They do make clear wires, but you can still see them. So that's a little bit typically more expensive than...
Kind of looks like a retainer.
Right, exactly, with the wire. A very popular option for adults has been and continues to be the clear retainers that we offer. And these are clear aligners that are removable. They're worn, each set is worn for about 2 weeks, and they're so set number 1 leads into set number 2 and so forth. So if you do 20 or 30 of them, you actually can get a lot of the alignment improved. The downside to these is that they're removable. They need to be worn about 22 hours per day, and that means if you're not motivated to wear them, if you're not disciplined, then you start not wearing them enough, and then the next set of aligners will not fit. So there has to be definitely a discipline to wear them and wanting to get the teeth straightened no matter what. So you have to have that kind of personality or a temperament. For those who don't want to show braces, and they are not interested in having another chore to do where they're removable, another option that's less popular because it's definitely more expensive is the lingual braces. They're on the insides of the teeth. These are custom made, so they tend to be pricey. What I mean custom made, they make them out of wax, then they cast them. They are made by robots, so the wires are all custom made, and that's different in comparison with the metal or the clear braces, because the metal and clear braces fit on the outside surfaces of the teeth, and these surfaces tend to be consistent, so they can mass produce them, whereas the inside surfaces of our teeth are unique. So they have to make each and individual one of them. So it tends to be expensive, maybe more emergencies than this kind, where a wire poking definitely intrudes on the tongue, but once you get used to them, they do a good job. So and it's so typically for executives, they have presentations to give. It really works well. These two are most popular, and I can tell you that this is very, very popular now. What we notice is that with adults placing an appliance in their mouths, there's an initial adjustment period. Kids are much more flexible in adjusting to new events because their body is stretching, they're getting taller, and things are changing on them. We as adults have a harder time adjusting to change. So the initial period is, I believe, more difficult For adults, it's not that difficult, but it takes about a week or two to get used to a set of braces on your teeth, and it's not the pain of moving the teeth, it's adjusting to something that wasn't there before, that's suddenly on your teeth, that's rubbing your cheeks. So just like I always liken it to gardening. When you start gardening in the spring, you get you get these sores on your hand, and then after a week or two, you basically get used to them. And it's the same thing with braces. That adjustment period tends to be a little bit longer with adults, but otherwise, the moving the teeth is fairly similar. Sometimes the bones, teeth are set inside bone, and we need to move them through. With adults, the bone is more dense, so it could be a little bit slower at times. But other than that, it's fairly similar.
Okay. You mentioned earlier about the odor when it comes to getting braces. My question is, I've seen that a lot of pharmacies and basically a lot of drugstores have the different utensils that you use
to
to
get the
clean
plaque.
them.
Yes.
What kind of utensils could an adult use actually to clean their teeth?
Well,
Safe ones.
yes, of course. The one thing about braces is they trap foods. So you eat a sandwich, it's going to be smeared everywhere. So because the tongue action cannot remove the food, compared with somebody who doesn't have braces, they can just run their tongues and the food will be removed. With braces, it's trapped in between, so you must brush after every meal pretty much. So even if you have to pack a travel toothbrush. So of course, a toothbrush, the areas we want them to concentrate on is the areas between the braces and the gums. These are called the danger zones. This is where food tends to accumulate, and this is where plaque forms because we have bacteria in our mouth, and this is where we get stains on the teeth, and this is where you're likely to get gum problems if you don't remove that food. So we recommend brushing for at least 3 minutes, focusing on those areas. Now, a water pick would be great, which is a jet of water to kind of hose down some of the food. It works as a pre-brushing sort of aid, and then you brush. We also ask our patients to floss their teeth with the wires, and a lot of times I get blank looks like, what do you mean? How can you brush? How can you floss with the wire? Well, we have these things that go in between so that the floss actually gets to go above the wire, and then you have to floss each and every one of them. So the gamut of things that are available for brushing is very useful. So water pick is great. If you don't have one and you want to use the toothbrush, it's perfectly fine as long as you're thorough and you floss. We recommend fluoride rinse to protect against the cavities, and these are recommended before going to sleep, after brushing and flossing. Take a mouthful of fluoride rinse. It doesn't matter what brand, as long as it says fluoride on it. Take a mouthful of it, swish it around for 1 minute, and then spit that out. No rinsing. Go to bed. Okay. And it coats the teeth overnight, and it prevents stains. But with adults, another factor is the periodontal disease, so we want to definitely floss in between.
Kadan.
You're welcome. It's been a pleasure speaking with you, and hopefully we'll meet in the future.
Yeah.